international colleagues are getting paid better than us, and they're working less hard than us. So actually, from a selfish perspective, you could make an argument to just sit back quietly, don't turn up to any of the pickets, don't turn up to any of the strikes, and just wait for nature, the corporate nature, to take its course. Let the NHS collapse, and actually we'll all be, we'll all be doing all right financially in the long term. It's just that you'd have to swallow your moral sort of, high ground, and admit that there's going to be some patients that are going to have to be the have-nots, and then access to healthcare. And it's going to be like America, where I went there on an elective 10 years ago, and I wanted to be a neurosurgeon at the time. I thought it was interesting to just open skulls for your whole career. And then I realised that it's not for me after I did it as a junior doctor. But I saw 2 patients in a row, 2 patients apart in a neurology clinic, and the attending in Harvard, sort of, smart guy. The first question he asked this patient as he breaks the bad news that she's got MS is, well, what insurance policy are you on? And he looks at his computer. He sort of had Epic back then, their better version, and he sort of said, oh, you're on policy D. Sorry, like all you can afford is acetaminophen, and he sends her home on paracetamol. And I'm sitting there as a final year medical student thinking, I don't want to be that doctor. The first question I'm asking is what policy you're on, and then essentially determining whether I can treat someone or not based on that. What made it worse is 2 patients later, he sees another lady in her late 40s with exactly the same subtype of MS, relapsing, remitting. It's not good, you're going to be in a wheelchair, but don't worry, you're on policy A. We're going to throw everything in the kitchen sink at you. We're going to treat you with stuff the NHS hasn't even heard of. We're going to basically experiment on you. We're going to enroll you in trials. We're going to experiment on you. We're going to give you stuff that the NHS might never actually give out because we've learned from their bitter experience it doesn't work. But she's paying for it, so that's fine. So she's paying to be a guinea pig, and the other patient's being shafted because she's poor and they're not going to give her the stuff we know is cost effective when we're giving patients to improve the quality of their life. So it's not hard to see why in America their outcomes aren't as good as ours, because even though they've got 3 times the funding, they're wasting that money, and actually they're shafting the rich patients and the poor patients. So it doesn't really work to say we need to privatise healthcare. There's a lot of reasons. I mean, there's lots of reasons why a socialised sort of universal healthcare system is better for patients, which is why Obama is trying his best to give them universal healthcare. There's much resistance, because obviously a lot of businessmen and a lot of wealthy people are against it. But, that's one thing the American system does a lot better than ours, is that they do make a few people very rich, and they make much more profit than we're making. So yes, they save money, but we're trying to save lives. We're trying to improve the quality of people's lives. And if it means we're being paid less and work harder, then that's fine. We've taken that hit. I know that doesn't make sense to the guys in Westminster and some of the bankers in London, but that's why we're here today, I think. What do you guys think? So when the media says doctors are greedy and they want a pay rise, or we're offering them a pay rise, did anyone ask for a pay rise here? Did any junior doctors ask for a pay rise? No. And when the media is saying, oh, but they're offering you a pay rise, what's that? Does anyone agree we're being offered a pay rise? They're talking about a pay rise, which is just ridiculous, because they're taking away our unsocial band, which makes our meagre pay respectable. Woo! They're taking away a 40 to 50% banding on our basic salary, and they're replacing it with a 10% at best banding on our basic salary. So to anyone who hasn't, you don't need to do GCSE maths to see that's a pay cut. And they're selling it in the media as a pay rise. I just think this is just it's an insult. It's an insult to our public, not just to the doctor. Obviously to us as doctors, we're used to being slapped in the face. But it's a slap in the face to every member of the public as well. And I think, I couldn't hold back at the protest on Saturday that we held and sat down outside Downing Street with our surgical masks. And we had just a simple message. I don't know, did anyone see that protest? You were there, well done. Did anyone else go there here, or was it? Well done to the few who came. It was cold and it was windy, but I think the message was loud and clear. And I think we 4 sort of organisers had just surgical masks, and we had a simple message on the masks, just junior doctors speaking out for patient safety, written on the masks. And we literally tried to deliver those to Downing Street. And ironically, they wouldn't listen. They wouldn't take those masks, which is just naive. Again, all they had to do is accept a simple gesture. But interestingly, the police standing outside Downing Street with their machine guns, with a hand over the face, so that it wasn't being filmed because you could lip read. It's like, we're completely behind you guys. We know everyone's been shafted. And I sort of said to him, I'm sorry, but the media are not representing this properly to the public. And he said, yeah, we know. Like 2 weeks ago, someone dropped a pig's head outside Downing Street, and it wasn't not even a peep in the media basically about it. And it's just, it's amazing how you can control people's democracy. And right now, this is being played out. And there are probably some of us who want to see it play out, because actually it does get frustrating after a while. And actually we're working hard, and if the public don't stand up for their NHS, then I think people's will eventually break, because we're busy and we want to have a life as well. So every time you get a break, you're out in the cold, you're shouting, and the media sort of gunning you down. The Department of Health, etc. They're constantly, this is all they do, is meeting after meeting about how to brief and how to release press releases and all this, and that's what we do full time. We're not full time campaigners. I mean, we're sort of off the hoof. We're coming out because we're desperate. Our backs are to the wall, and we don't want to work in a more unsafe environment. And it's a safety critical industry. And I went to a sort of media training day, and perhaps I put my hand up. Maybe I'm failing to communicate properly. I think I am failing to communicate properly because. Has anyone seen the interview I did with Sky News when they came at the last sort of protest? I thought I did a good job. I was sort of patting myself on the back. I made it seem simple. I broke down those figures. Thought I was doing well. But the media guys were sort of saying to us, well, actually, what you don't get is that the average person, the psychology of all of us, is that we don't process data that way. So as soon as you're explaining the data, you're losing the public battle. And that's why the government doesn't usually give out much data. They give out very few bits, and and they don't have to be accurate. So part of actually winning the campaign is explaining to patients and the public how it will affect them and their relatives and their families. Which is why we need our patients to be here as well. We need patients. So are there any patients here, guys? We've got a few. Give them a round of applause. So there's a few clever patients who've worked it out. Usually they're ones who use the NHS. Unfortunately, people who don't use the NHS, they don't appreciate what goes on. They have no idea. In fact, even at the Department of Health, they don't know what doctors and nurses are up to on the front line. A lot of the guys who are making these decisions haven't worked a day in their life. They haven't seen a day in the life of a junior doctor. On a weekday or a weekend. They come, schmooze a few managers and then go home, basically go back to the Department of Health. They literally think, they probably still think it's like doctor in the house. They think that we're cotton wrapped, we're getting coffees and sleeping around with the nurses. They think this is an old, they do not realise. And I've heard this from a guy who's done one of the fellowships at the Department of Health. So this is not, I'm not making this up. This is doctors who've gone in to the Department of Health, and this is the perspective in the Department of Health. So, I think we all have fun and we all work hard, but they are making decisions that are going to impact on the front line. And the decision they're now trying to make, stretching junior doctors to cover routine work at weekends without providing funding to resource those weekends properly, to have the proper support staff, is frankly dangerous. So, that's why we're standing here today, because that's our livelihood, that's our careers on the line. It only takes 1 or 2 patients that die under your watch, your career's finished. And obviously, it goes without saying that the loss, the tragedy of that unnecessary loss, and there'll be lots of unnecessary deaths. Again, come back to what the media people tell us. 1,000 deaths is just a statistic. 1 death is a tragedy. So when you communicate, when you're all getting a chance to communicate to the media, explain how that tragedy is going to unfold under your care. When you're that anaesthetist transferring a patient from a district general to the teaching hospital in an ambulance, and you're tired and you've been overworked and you're overstretched, and you haven't got a member of support staff with you, whether it's a paramedic or a nurse, how would they feel if that was their son who's had the road traffic accident and they've got a tired doctor who hasn't got any support staff with them? How would they feel if that was their kid on the theatre table having heart surgery, knowing that the surgeon is just thinking, well, it's the end of my shift now? Imagine that surgeon getting up and getting out and letting another surgeon take over in the middle of an important, crucial step in an operation. Because that's what they're saying. We're going to cut your hours. We're going to make you work a few hours, but we're going to do it any time, either at night time on a Sunday night or on a Tuesday morning. Well, how are you going to do that without having more doctors? Who's going to fill my Tuesday clinic when I'm covering a Sunday clinic? How am I going to work the same number of hours and cover those the extra 40% hours in the weekend? It doesn't make sense to anyone, Again, we're coming back to the data, and the public don't understand that. So you need to, none of us do. That's our psychology. It was illustrated really well. There was a company, there's hotels, and they were trying to do the right thing. And they want to, have you seen those signs in the hotels where they try and encourage you not to put your towels on the floor unless you're done with them? So try and keep them for the couple of days that you're there, rather than just throw them on the floor every 5 minutes. And obviously that's the right thing to do, and we all sort of know that. Inherently, like, intelligent people know that, and actually you don't need to be that intelligent to understand that if somebody tells you. But what they found was they put this information down about how the environment was being devastated by that effect, and they represented it in a few stats. So they had a sort of short paragraph with, did you know that, you know, this many people are, you know, basically screwing up the environment by doing this, and this is how much you can help. And they had a bit of an uptake. They found that about 20% of people were using less of the towels. And then they actually said, well, hold on. They got advice on how to improve it, and this PR company said to them, take away some of the data there and just put down that, you know, 80%, put down at the bottom of it, 80% of people who stayed in this room sort of, you know, didn't throw their towels away until the end of their stay. And guess what? People started to do it. And, you know, then they said to them, well, take away all that little data and just say, did you know that, you know, 90% of people that stayed in your room didn't throw away. And the more personal you can make the message, the more likely people will understand. Okay? And it's the same thing that goes for sort of, you know, if we're trying to help out Africa, we want to like donate money to like kids. We all know that there's malnutrition. We all know that they're financially in trouble. We all want to help. But how do you get people to then take part in that process? Well, if you give them all the stats and you tell them, look, you know, 50% of children are dying before such an age, and this many children are starving, and this many are dying just from dehydration alone and diarrhea. Well, actually, people know that, but they won't do anything about it. But if you give them a story about one child who's died, and you say, look, this 4-year-old, or I cared for this one patient, and if I didn't have the presence of mind, if I was tired and I'm demoralised, you know, my rota was too short because a few more doctors have left for another country, well, people will start to think if that was their kid, or if it was their brother, or their mum, they'll think, hold on a minute, yeah, you're right. So do try and explain it that way. Don't get sucked into all the data, because often when you're being asked by people, they say, well, you're being given a pay rise. Or the media will say, but they're giving you a pay rise. Why, you know, it's a pay dispute, isn't it? It's always painted as a pay dispute. But yes, the pay is an issue, and we're going to lose more doctors abroad if we keep on having a panel, because being a doctor in this country becomes not financially a viable option. But it's a patient safety issue in the end of the day. Okay, so the analogy, the good analogy, and we've always had this, junior doctors. How many junior doctors are here? Okay, quite a lot. So how many of you have had safety training, patient safety lectures that have touched on the airline industry? Anyone? So we've had it rammed down our throats, haven't we? We'll have the airplane pilot come in and he'll say, I've retired, but now I make money out of lecturing the NHS about how, you know, how we're a safety critical industry and you guys can learn from us, right? Trouble is, they get loads more investment than us in that. They're trained all the time. I mean, my dad was a National Air Traffic Control senior quality manager, and he interviewed air traffic controllers and pilots. He sees the sort of stuff these guys go through, the amount of simulation training they get, etc. They are very safety conscious. They, you know, any near misses are investigated to the umpteenth, and they learn from those lessons, and they will ground the planes if there's an issue. Okay, so you know so we can use that to our advantage. Okay, we've had it rammed down our throats. So let's imagine it's an airplane scenario. So Jeremy Hunt and the Department of Health are asking us to fly more planes on weekends, but they're not going to give us any ground stuff. Okay, there's going to be no one that's going to help you take off and land. You're going to just be flying around, and there's going to be no extra resource or support. Is that safe? No. No. Is that an analogy that, like, you know, can work? Can any member of the public understand that analogy? Yes. Is it a fair analogy to make? I think so. So if they want to have more weekend working, they need to adequately staff and resource those weekends first, and then they can ask for extra work. And actually, let's have more pilots as well, because otherwise we're going to be unsafe. So I'll leave you. Oh, we've got a question.
They've also not said that when you're flying a plane, you're just flying a plane, not doing all tasks at the same time. It's
Right.
far more complex.
Right. And, you know, gaps in the rotor, so you're flying the plane, there's no co-pilot, there's no landing support staff, and there's no, you know, there's no landing strips, you're flying around. All it takes is one crash, and that's your career over. Airline industry, you're out of business. But the NHS, it's fine, you know, it's someone else's life, and if they can't afford proper care, then, oh well, you know. So I think, you know, I'll leave you with that thought. Just think of your patients, and think of patient safety. I think there's a cynic within me that says that maybe even some of us doctors, we're members of the public too. And we can only be prejudiced by our media as well. So people don't realise that this is ultimately about patient safety, and we need to stick to that line, and we need to defend our patients. Right. Give us a shout, warm yourself up, come on. Shout if you're a junior doctor. Shout if you're a patient. Is there any nurses here? One nurse, well done, well done. Give her a round of applause. Okay, I'll pass you on to Tim, who's doing a great job. Is there a paramedic in the house? Hey! What other, have we got any other professions that we're missing out? Ambulance guy, any students around? Hey! Well, it's all about you guys. Well done for coming out, because you need to speak to all your guys, because this is, we're being told it's not going to affect us. They're giving us apparently a bribe. We're going to be all consultants by the time it goes through, but you guys are going to get hammered, so you need to tell people about that. Right, I'll pass you on to Tim, who's been doing a great job with organising, and, you're going to tell them about 1 PM? Awesome. See you guys at 1 PM.
So, thank you very much, Yes. Thank you.